Hello, everybody. Welcome to my YouTube channel, Homoeopathy Supersessions by Dr. Jacques. Today, we'll be doing the study of symptomatology, the second part. Now, let us go further from the eighth point, that is the keynote symptoms. So, keynote symptoms are characteristic symptoms which point to a small group of remedies and they rarely indicate a single remedy. Now, this is very important. Generally, the answer in the examinations which you all give, a keynote symptom is the one which indicates the remedy. That is wrong, but they are characteristic symptoms which point to a small group of remedies. So this is very important. They are those character symptoms which point out to a small group of remedy and they rarely indicate a single remedy. It's a prominent symptom for remedy which distinguishes one remedy from the other or more or less of the same group. So in the same group is there and there are two seemingly similar remedies. So one prominent symptom may distinguish it from the other remedy. Its function is suggestive and draws attention to the symptom totality. So keynote symptoms, we can definitely form the totality. They are considered as reliable pointers to the remedy. A single symptom hardly ever indicates the remedy. At least three keynote symptoms are essential before one can pick up a substantially similar remedy, also known as Allen's three-legged stool. So basically, a stool with three legs is more firm. Therefore, Allen said that at least three keynote symptoms have to be present in order to have a successful prescription. Okay, so a leg with two stools may not be very firm. It may wobble, it may fall down. So therefore, Allen said that at least three prominent keynote symptoms have to be present in order to indicate the correct simile. Pathological generals, Boger emphasized that certain tendencies of tissues and propensity of certain types of abnormal changes are important aids in the selection of the remedy. So Boger, as you all know, he gave importance to the pathological generals. So he disagreed on Kent's view by saying that every time take the mental symptom into consideration. Boger was of the opinion, or he said that if in an advanced case of advanced pathology or a case of advanced pathology where the pathology is advanced, here you may not get any mental symptoms. You just get the pathology. So how will you prescribe? By only taking the pathology into account. So therefore, Boger emphasized that there are certain tendencies of tissues or propensity of certain types of abnormal changes which are important aids in selection of the remedy. For example, sepsis, calculi, cysts, fibrous tissue, hemorrhage, warts, ulcers, these formations, etc. So Boger gave rise to the importance to the pathological generals. Alternating symptoms. They are when two groups of symptoms alternate with each other and have no fixed period of time, it becomes a general symptom. So alternating symptoms are two groups of symptoms alternate with each other, having no fixed period of time. For example, asthma alternate with the skin complaints. So alternating symptoms become a general symptom. So it is difficult to identify an alternating symptom only after the third or fourth interview. Probable some hint may be given by the patient that this is an alternating symptom. Now, paucity of symptom. Sometimes, in spite of our best efforts, we can get symptoms except only a few. Sometimes, in spite of our best efforts, we can get symptoms, or rather, we cannot get symptoms except for a few symptoms. In such cases, the vitality is lowered either because extensive therapy or due to chronic incurable disease. So sometimes, in spite of our best efforts to take the picture of the disease, we only get a few symptoms in our hand. Why does this occur? This occurs because the patient's immune system is low or the vitality is low, either because of the extensive therapy what the patient has taken or due to a chronic incurable disease. In such cases of poor symptomatology, we can see the rubric reaction poor from Kent's repertory under the heading generalities. So in such instances, we have to take the use of the repertory, Kent's repertory under the heading generalities, reaction poor. You'll come across a group of remedies. There are around 6 or 7 remedies only. Out of the 6, 7 remedies, see which remedy best can fit into the totality. Prescribe that remedy. After prescribe that remedy or after giving that remedy, the case will open up, retake the case, and again prescribe. the maze of symptoms. It is a mass of symptoms which the prescriber feels lost. So patient will tell you so many symptoms, you will not know which symptoms to take and which symptoms to leave out, or you will not know what is the starting point of the case. Why? Because patient goes on expressing him or herself in vivid colors. Very often the patients have been victims of indiscriminate treatment, both suppressive as well as homeopathic. So why does the maze of symptom occur? Because the patients have taken indiscriminate treatment, both homeopathic as well as of the modern medicine, which may be also suppressive in nature. The result will be addition of symptoms of the drug-induced disease, which is mixed with the original symptom of the disease, forming a maze of symptoms. So, what happens when you go on taking treatment, which is harmful? It will have these side effects. So, at one end you have the original symptom of the disease, and at the other end you have the side effects of the medicine. Now, both are not watertight compartments. Both of them get mixed up. So, it's very difficult to identify the original set of symptoms from both of the side effects. And it is impossible to find out a single remedy. So in such cases, one may prescribe an antidote to the previous prescription if known. So if you know what homeopathic, probable the patient has taken homeopathic medicine or allopathic medicine has come to you. If you've taken homeopathic medicine, if you know the previous prescription, you can antidote it, or you can just use a general antidote, as you all know, camphor, nux vomica, and coffea cruda, or a particular indicated remedy based on recent symptoms. Or if you still cannot identify what is wrong, you can even antidote it by whatever recent symptoms are there, take that totality and prescribe. That will also be an antidote. Or administer a placebo till the symptoms become indicative of a single remedy. Or just give a placebo, wait for the side effects of the medicine to wane away, and the totality may become then clear. So this is how you treat a maze of symptoms. Now, eliminating symptom. It is a keynote symptom taken first for hepatization, and the remedies covering symptoms are only considered from the other symptoms of the case. So, an eliminated symptom, the keynote symptom, which is taken first for hepatization, it eliminates a large number of remedies in one stroke, therefore known as eliminating symptoms. So, you have, if in a totality, patient is chilly, then you will automatically eliminate all the. So once you've repertorized the case, you will automatically eliminate all the hot remedies and only take the chilly remedies into consideration. So it eliminates a large number of remedies in one stroke, therefore known as an eliminating symptom. It is a shortcut method in prescribing in hands of experienced homeopathic physicians. So this method can only be used in an experienced homeopathic physician. However, for beginners, it is not good method, as if the symptom select is not correct, the whole case processing will be wrong and the synonym will not be easily obtained. So in the hands of beginners or in people who have just started their homeopathic practice, this sort of an eliminating symptom should not be taken into consideration, because if your choice is incorrect, everything will go haywire. Accidental symptom. They are also known as spurious symptoms, synonymous spurious symptom. They are those symptoms which neither help us for the diagnosis of the disease nor for the indicated remedy. So these symptoms are totally useless. They do not help us in the identification of the disease nor for the identification of the symptom. Therefore, such symptoms should not be given any importance and should be left alone. So just ignore these symptoms and let it be. Clinical symptoms, they are not observed in provers but found in patients who are cured by the remedy. So it may be such that after giving a particular drug, that symptom doesn't come under the preview of that drug, but still symptom is cured. So this is known as a clinical symptom. Now, peculiar symptoms. They are unused symptoms which belong to the patient and not to the disease. So peculiar symptoms, they belong to the patient as a whole and not to the particular disease. They cannot be explained on usual pathological and physiological basis. Example, burning pains better by what? Rare symptoms. They are those symptoms which appear in very few provers because they have a great sensitivity and susceptibility to the drug too. So rare symptoms are seen in only maybe out of a group of provers, only one prover will have these rare symptoms, because the patient is often because the person has a very very great sensitivity to the drug. Therefore, though the symptoms appear in a few provers, yet the remedy is able to cure the symptoms if given the patient having the same symptoms. So though these symptoms may only appear in one or two provers, but they can be useful if the patients have the same symptoms and the similar can be obtained. Pathogenic symptoms are those symptoms produced by the drug or toxic subjective and objective symptoms in matter medica is a record of the pathogenic symptoms. Accessory symptoms. It is given after number 95. They are those symptoms which the patient is suffering for a long time and thus considered as a part and parcel of its normal life. So it may so happen that the patient is used to this a certain complaint and he thinks that this is a part and parcel of his normal life. They are very important in one-sided chronic disease, example, diarrhea after eating. So the patient has this complaint since many, many years. So he considered it as a part and parcel of his normal life. So I think it is a normal phenomena and it occurs in a one-sided chronic disease. Generic symptoms, also known as characteristics of the group, they are produced by dynamic generalization of the drugs. They are common to many drugs in one class. Example, morning diarrhea is characteristic symptom, but only possessed by a few drugs. Basic symptoms. It is a term used by Garth Borick in his book, a compendium of the principles of homeopathy for students in medicine. They are pathognomic and common symptoms which appear during proving. They are used for diagnosis of the disease. They are not used for selection of the indicated homeopathic remedy. Excuse me. So basic symptoms are introduced by Garth Borick, and they are only important for the diagnosis of the disease and not for the selection of the similar. Example, headache, malaise, weakness. These are known as common symptoms of Kent. So Kent has classified them into common symptoms, Hahnemann has classified them into general symptoms, and Garth Borick has classified them into the basic symptoms. That is, those symptoms which will help us to identify the disease phenomena. Now, determinative symptoms. This is also another term used by Garth Borick. These are symptoms which are necessary for the homeopathic prescription. So, determinative symptoms, as the name suggests, they determine the homeopathic prescription. They constitute the mental, physical, general, and the PQRS symptom, that is the totality of symptoms. So, as you all know, the totality is formed on the mental, the physical generals, and all PQRS symptoms. So, the totality which is formed on a characteristic level, on the mental, physical level, particulars, and the pathology will help you to determine the totality, known as the determinative symptoms. So determinative symptoms are those symptoms which determine the prescription, and the basic symptoms are those which determine the disease phenomena. Now, toxic symptoms are caused by toxic substances, either internal or external into the system. They require antidote in emergency, example, toxemia of pregnancy. Physiological symptoms, they are those symptoms which under changed conditions are classified as disease, otherwise it is physiological. Example, amenorrhea. Negative general symptoms, it is absence of the expected feature of the case. So in a case, whatever feature is absent, which you may expect in a case, that is known as a negative general symptom. It gives us important data. Example, asthma not aggravated in damp weather will exclude remedies like napkins or brush dogs, Dharkamara, etc. You should remember that symptoms must have been elicited properly and found absent. Another examples, complaint aggravated by change of weather will exclude remedies like phosphorus, silicea, and tuberculin. So please remember that whenever you're taking negative general symptoms, they have to be elicited properly and found absent. Now, generalization. During the study of symptoms, we see that a symptom will be complete only when it covers the location, sensation, modality, and concomitant. Boniusen, while studying cases, found out that there were incomplete symptoms which were becoming obstacles for the case while solving them. So, as you all know, in generalization, a complete symptom is one which has location, sensation, modality, and concomitant. But Boniusen found out while studying cases that many a times the sensation was missing, or the modality was missing, or the concomitant was missing. So this formed an obstacle to the case while solving them. So what did he do? Boniusen found out what is true for the part is true for the whole. So what is true for the part is also true for the whole. That means what? If a sensation is missing in one part, but it is there in the second part, then he has generalized it on a grand level, and he has put that sensation in that incomplete sensation which is not there and made it complete. Thus, he generalized all the modalities and sensations and reduced the whole matter medica into location, sensation, modality, and concomitant. Bonus agreed with Hahnemann's opinion that the person is suffering and not his parts. So just let me make it more simple for you. Suppose the patient has headache, he has pain in abdomen and pain in legs. And in the headache, he's not able to tell you the sensation. In the abdomen, he's told you throbbing sensation, and in the legs also he's told you throbbing sensation. So this throbbing sensation, which is present in the abdomen and the legs, can be used on a general level also for the head where the sensation was absent. So therefore, he said that he generalized all the modalities and the sensations and read his whole matter medica into location, sensation, modality, and concomitant. What is true for the part is true for the whole. So in this way, the incomplete symptoms became complete and the obstacle to cure was removed, and you could also prescribe the similar. Thus, when the modality and sensation are applicable to one part, it will be true for the other parts also. So I just to give you the example that if a sensation is absent in one part or present in other parts, that can be transferred to a general level and got into the part where the sensation was not there. This is known as the grand generalization by Bonnier. Also, Robert and Boger supported grand generalization by Bonnier. So this is very important that Bonnier did grand generalization in which the sensation, the modalities were incomplete in one symptom could be completed by generalizing on a very grand scale and thus completing it and removing the obstacles to cure. So that's all for all this for all this video. Two parts. I've explained to you the different symptomatology. In the examination, sometimes you may also get questions, a short note on objective symptom, subjective symptom, or the question can come, explain the relative value of symptomatology in homeopathic prescribing. So this video will become very, very useful. On the Viva, they may also ask you which modalities are more important, what are concomitant symptoms, define concomitant symptom, give an example of concomitant symptom. And also, they will also tell you in which cases we'll only refer to objective symptoms. So all these are questions which are asked in the Viva as well as in the theory. Hope you enjoyed this video. If you're new to the channel, please do subscribe to my channel. Thank you very much.